We're going to move straight into the highlight of the session, which is eliminating these HPV-related cancers. But before we do that, let's kind of review what is human papillomavirus or HPV. Now, hopefully most of you know that this is a very common virus. And in fact, around 80% of people will get HPV in their lifetime. The good news is that most people will clear the infection on their own. The bad news is that not everyone does, and we really don't know why some people will clear and some don't, and how to predict that. And unfortunately, 1 out of every 20 cancers is caused by HPV worldwide. So what are those cancers? Well, most are familiar with cervical cancer, but that is not the only cancer that HPV causes. And in fact, HPV causes multiple cancers in men as well as in women. And you can see here that what is in common for both men and women are cancers that of the oropharynx, that's the throat and the back of the mouth, anal cancer. And then among men, they also can develop penile cancer due to HPV. And for women can develop cervical, vaginal, and vulvar cancers. So all in all, there are 6 cancers that HPV causes in both men and women. Well, what does that look like here in the United States? For the women in the audience, you're probably very well aware that we have screening for cervical cancer. And that screening and treatment that follows has done a lot to reduce the incidence of cervical cancer in the United States. And in fact, what I'm showing you in this solid line is what that decrease has looked like over time. So it's slow, it's very progressively slow, moving down to a much lower level than what we had before. But what I'm showing you in the dotted line is the incidence of oropharyngeal cancer among men. And what you can see is it's going in the wrong direction. It's going up. And in fact, every year there is an increase in the incidence of HPV-related oropharyngeal cancer in men. And that increase is around 2.7% per year. So I kind of like to think of it, if we actually had our banking systems working well with interest rates, you'd say, oh, I'm investing my money, I'm getting 2.7% more per year. Except this is a cancer. And that is not what we want for cancer. It should go in the opposite direction. Now, there are a lot of reasons why that's happening, and I will talk about that in a little bit. But this virus, there are all these different types. So it turns out that human papillomavirus is one family of viruses, but there are many types. And in fact, those types cause different diseases. So most cancers are caused by these 7 HPV types that I've listed here. So for those 6 cancers, most are caused by these types. Probably the most important one for both men and women is HPV 16. So what happens when you get an HPV infection? Well, as I said earlier, these are really common viruses. So there's this initial infection that occurs. And most people are able to clear their infection completely. So that's the good news. And again, we do not know why some people continue with an infection. Why does it remain persistent? Now, for those who have persistent infection, a high proportion will develop, and in this case, cervical intraepithelial neoplasia, or another way of saying it is a high-grade cervical lesion that needs treatment. And if the woman is not going for treatment for this lesion, over time, that lesion will progress and develop into invasive cervical cancer. Now, in cervical cancer, the good news is we can interrupt that cycle. And we have several ways of doing it. Well, the first is that we have a vaccine. So that would prevent the infection to begin with. So these high-grade cervical lesions would never develop. But for women who have been past the age of vaccination, we have screening and we have treatment for those lesions that are screened positive. And in fact, even if a woman has been vaccinated, she needs to continue with screening and treatment based on provider recommendations. This is one of the most important messages that we can give. Yes, get vaccinated, but don't forget about screening and treatment, because it is the whole package that's going to help us to prevent cervical cancer and ultimately eliminate it. So what is this HPV vaccine? Well, most of what we have here in the United States is the 9-valent HPV vaccine called Gardasil 9. So it protects against 9 types. Now, I showed you these cancer-causing types before, but what I didn't show you yet is the 2 types that cause genital warts. And actually, genital warts are fairly common among both men and women. In fact, probably more common in men than in women, and causes a lot of anxiety, really difficult to treat. And you can imagine a lot of psychosocial distress. So the vaccine prevents 90% of those HPV-related cancers that I showed you, and nearly 100% of the genital warts. So this is a good news story for all of us. Okay, well, who should get vaccine? Well, all males and females ages 9 to 26. There's a routine recommendation for vaccination. What the public health authorities are trying to do is to target 11 and 12-year-olds, because there's this really nice package of adolescent vaccination during an adolescent well visit. So we'd like to get that vaccine at the same time that the adolescents are getting their other required vaccines. But what about mid-adult males and females? Great news, we have FDA licensure for the vaccine up to age 45, and the recommendation is to speak to your provider about getting the vaccine. So for adolescents, it's only a 2-shot series. For those 15 and older, it's a 3-shot series. But remember that 3-shot series or 2-shot series prevents up to 6 cancers as well as genital warts. We have plenty of evidence showing that the vaccine works. I'm showing you all the lovely flags from all the different countries that have demonstrated and published their results that the vaccine prevents the infections, the genital warts, the precancerous lesions, and now we have evidence that it will prevent the cancers, cervical cancer. So all in all, great news. So what can you do? Well, the first thing is to speak to your provider if you're a mid-adult age, and make sure that you have access to the vaccine and also for screening. And it's vaccine, screening, treatment, and prevention. We want everyone to get up to date to eliminate HPV-related cancers for yourself, for your family, and for your community. Everyone should consider vaccination in the age groups that I've shown you. And remember to think about screening and talk to your provider about screening. Here are the recommendations. If you're 21 to 29, it's a pap smear every 3 years. If you're 30 to 65, it's a pap smear with HPV testing or HPV testing alone every 5 years. Simple enough to do. So if we do that, and if we can get everybody on board, and number one is to remember screening and treatment, this really pretty green line shows what happens if we can get 90% of women screened and treated for these precancerous lesions. We will hit the WHO goal to eliminate cervical cancer as a public health problem by 2028. That's in 7 years. Come on, this is possible. We can do that. And if we continue, the green line shows us that we can get to near disappearance of cervical cancer, less than 1 woman diagnosed per 100,000 by the year 2063. That means for our children, our grandchildren, they will never see this cancer again. This is an important goal. It's a goal that the World Health Organization has taken on, and you can see all of the different organizations that have endorsed it and are partnering to make this happen. So where are we now in the United States? We're around 8 per 100,000 for cervical cancer. In 7 years, I'd like to see us get to 4, and soon thereafter to less than 1 per 100,000. And so I will leave you with that. It's a call to action for yourself, for your family, your community, and ultimately for the world. Thank you very much.